If you're on Losartan, there are 7 things sitting in your kitchen and your medicine cabinet right now that could send you to the emergency room. Most people taking this drug have never been told about a single one of them. Losartan is one of the most prescribed blood pressure medications in the world. Millions of people take it every day, and for most of them, it works quietly and does its job. But Losartan doesn't act alone in your body. It changes how your kidneys handle potassium, how your blood vessels respond to pressure, and how other drugs get cleared out of your system. When you combine it with the wrong thing, those changes stack on top of each other. And the results aren't always small. Here's what's misunderstood. Most patients think a drug interaction means something dramatic, like a warning label with a skull on it. In reality, most Losartan interactions are quiet. Your potassium creeps up over weeks. Your blood pressure drops just enough to make you dizzy when you stand. Your kidney function slips a little at your next lab check. Nothing feels urgent until sometimes it suddenly is. Let's start with potassium. Losartan works by blocking a hormone called angiotensin II. That hormone normally tells your kidneys to hold on to sodium and release potassium. When Losartan blocks it, your kidneys start holding on to more potassium than usual. For most people, that's a small, harmless shift. But add extra potassium on top, and it's a different story. Potassium supplements are the first thing to watch. Tablets, powders, and electrolyte drinks marketed for hydration or muscle cramps can all push your potassium level higher than it should go. Too much potassium in your blood is called hyperkalemia, and your heart is especially sensitive to it. Early signs are muscle weakness and an irregular heartbeat. In severe cases, high potassium can stop your heart from beating normally altogether. Second, and this one surprises almost everyone, salt substitutes. Products like Morton Salt Substitute, No Salt, and Light Salt are marketed as the heart-healthy choice. People switch to them specifically because they think they're doing something good for their blood pressure. Here's the problem. Most of these products replace sodium chloride with potassium chloride. So you're not just avoiding salt, you're adding a steady stream of extra potassium to every meal. Combined with Losartan, that swap can backfire in a way most people never see coming. Third, nonsteroidal anti-inflammatory drugs, pain relievers. Ibuprofen, naproxen, and diclofenac are sitting in almost every medicine cabinet in the country. On their own, they are generally fine for occasional use. Combined with Losartan, they cause 3 separate problems at once. They can reduce blood flow to your kidneys, which raises your risk of kidney injury. They can raise your blood pressure, working directly against what Losartan is trying to do. And if you're also taking a diuretic, that's a third drug pulling on your kidneys at the same time. Doctors sometimes call this the triple whammy, and it's one of the more common ways people on blood pressure medication end up with sudden kidney problems. If you need regular pain relief, acetaminophen is generally the safer choice, taken at the recommended dose. Fourth, potassium-sparing diuretics. These include spironolactone, eplerenone, amiloride, and triamterene. They're water pills, but unlike most diuretics, they're designed to keep your body from losing potassium. That's useful for certain heart and kidney conditions. But pair one of these with Losartan, which is already causing your body to retain more potassium, and your levels can climb fast. If you're on both, your doctor should be checking your blood work regularly, not just at your yearly physical. Fifth, ACE inhibitors. Lisinopril, enalapril, ramipril, and benazepril all work through a similar pathway to Losartan, just at a different step. Taking 2 drugs that block the same hormone system generally does not double your benefit. Instead, it tends to raise your risk of kidney injury, high potassium, and blood pressure dropping too low. Because of this, doctors generally avoid combining these 2 drug classes unless a specialist is directly overseeing your care for a specific reason. Sixth, lithium. If you or someone you love takes lithium for bipolar disorder, this one matters. Losartan can interfere with how your kidneys clear lithium from your bloodstream, which allows it to build up. Lithium has a very narrow safe range. Even a modest rise in its level can cause real problems: tremors, confusion, poor coordination, slurred speech. Left unaddressed, it can progress to full toxicity. If both drugs are necessary, they can often be used together, but only with closer monitoring than usual. Seventh, alcohol. This is the one people are most likely to brush off. Losartan already relaxes and widens your blood vessels to lower your pressure. Alcohol does something similar. Put them together, and your blood pressure can drop more than either one would cause on its own. That shows up as dizziness, lightheadedness, or fainting, especially when you stand up quickly. For older adults, this isn't just uncomfortable. A sudden drop in blood pressure is one of the more common causes of falls, and falls in older adults can lead to fractures and hospital stays. Now, a quick word on food, because this is where people tend to overcorrect. Bananas, oranges, potatoes, tomatoes, avocados, spinach, coconut water, dried fruit. These are all naturally high in potassium. That does not mean you need to cut them out. For most people on Losartan with normal kidney function, eating these foods as part of a normal, varied diet is not a problem. The concern is concentrated, easy-to-overdo sources like supplements and salt substitutes, not a banana with your breakfast. If your blood work has already shown elevated potassium, that's the point where your doctor should be helping you think through moderation, not before. So what does this actually mean for you? It doesn't mean Losartan is dangerous. It means it doesn't exist in isolation. Before you add anything new, a supplement, a new prescription, even a different salt shaker, it's worth a quick check with your doctor or pharmacist. That one question takes less time than reading a label, and it can prevent months of feeling off without knowing why. There are some symptoms that shouldn't wait for your next appointment. Get medical care promptly if you notice severe muscle weakness, chest pain, heart palpitations, fainting, very little urine output, severe dizziness, or new confusion. These can be signs that your potassium is too high or your blood pressure has dropped too far, and both are treatable when caught early. The bigger picture here is simple. Losartan is a well-studied, generally well-tolerated medication that helps millions of people manage their blood pressure and protect their kidneys. Most of the risks we just walked through are avoidable, not through fear, but through awareness. Know what you're combining it with, keep your follow-up labs, and loop your doctor in before you make changes. That's really all it takes to keep this medication working the way it's meant to. And there you have it. Take this knowledge and take control of your health. Thank you for watching.